Here are 8 important signs and symptoms to be aware of that could indicate bowel cancer. The first is a persistent change in bowel habit. So cancerous growths in the colon or rectum can obstruct the passage of stool. This leads to persistent changes in bowel habits and can manifest as either diarrhea or constipation. Tumours can also disrupt the normal transit of stool through the digestive tract, causing changes in consistency, shape, and frequency. But the persistent change doesn't always mean cancer. So changes in bowel habits may result from variations in diet, such as increased fiber intake or dehydration, which are unrelated to cancer. Emotional stress or changes in routine can also impact bowel habits without being directly linked to cancer. And conditions like irritable bowel syndrome can also cause persistent changes in bowel habits. Number 2 is blood in your poo. Colorectal cancers often induce bleeding due to the fragile nature of the tumour blood vessels, leading to the presence of visible blood in the stool. The colour of the blood can provide insights into the location of the bleeding. So dark or tarry stools may suggest bleeding from higher up in the digestive tract, whereas fresh or bright red blood can indicate bleeding from lower down in the digestive tract. Blood in the poo doesn't always mean cancer, so swollen blood vessels in the rectum or anus can cause bleeding during bowel movements, and this is unrelated to cancer. If you have chronic constipation, you can get small tears in the lining of the anus that can lead to rectal bleeding. And infections in the digestive tract may cause temporary bleeding without being cancer related. Number 3, abdominal pain or discomfort. As tumours grow, they can invade surrounding tissues, causing persistent abdominal pain or discomfort. Crampy pain that doesn't resolve may be associated with a tumour's impact on normal bowel function, but there can be non-cancerous causes of this type of pain. So inflammation of the stomach lining, gastritis, or ulcers can cause abdominal pain unrelated to cancer. Conditions affecting abdominal muscles or organs may also lead to discomfort without cancer being involved. 4, unexplained weight loss. The body can redirect energy to fight cancer, resulting in unintentional weight loss. Tumours can also alter metabolic signalling, leading to a reduced appetite and subsequent weight loss. The non-cancerous causes will be mental stress or changes in psychological well-being that can influence appetite and contribute to weight loss. Underlying metabolic or hormone conditions such as thyroid disorders can lead to weight loss without cancer involvement. Number 5 is fatigue, weakness, and tiredness. So anemia can result from chronic bleeding, which is due to the tumours, and this can lead to fatigue, weakness, and shortness of breath. Some non-cancerous causes would be nutritional deficiencies in things like iron, vitamin B12, or folate. These can all cause fatigue and weakness that are unrelated to cancer. Conditions such as chronic kidney disease or rheumatoid arthritis may also lead to fatigue without cancer involvement, and this is called anemia of chronic disease. Number 6, iron deficiency anemia. So this happens because of slow chronic bleeding from tumours that can deplete iron levels, leading to iron deficiency anemia. Non-cancerous causes would be poor dietary intake of iron that can result in iron deficiency anemia, which is unrelated to cancer. In females, heavy menstrual bleeding can contribute to iron deficiency anemia without cancer involvement. Number 7 is changes in bowel habits. The symptom is tenesmus, and this means being unable to completely empty your bowels. This can happen because of a tumour causing irritation, inflammation, or even partial obstruction of the rectum or colon. But remember, conditions like irritable bowel syndrome can also cause symptoms like tenesmus and incomplete emptying of your bowels. Inflammatory bowel diseases can also lead to similar symptoms without cancer involvement. But 8 is abdominal symptoms. So bloating, nausea, and vomiting can all occur if a tumour is obstructing the bowel and affecting normal digestion. But conditions such as gastroenteritis, which can be caused by viruses, and dyspepsia or reflux or gastritis can all cause bloating and nausea that are unrelated to cancer. Abdominal bloating can also result from fluid retention, which can occur due to various non-cancerous causes, and infections can lead to nausea and vomiting without cancer involvement. So while all of these signs and symptoms can raise concerns about bowel cancer, they are not exclusive to cancer. Non-cancerous conditions can present similarly. If you're worried about any of these signs and symptoms, please do go and get checked out by a doctor. It's very easy to assess you for bowel cancer. We can take a history, examine you, and then do some investigations that can look for cancer, but also rule in or rule out other conditions that might be causing your symptoms. A really good recent development in assessing for bowel cancer is the Fecal Immunochemical Test. So this is a FIT test. The FIT is a screening test that checks for hidden blood in your poop. It's different from the older tests like the fecal occult blood test because it specifically detects human hemoglobin, which is a protein in red blood cells. The old blood test couldn't differentiate between human blood and animal blood. So here's how it works. You'll get a kit to collect a small sample of your poop at home. Yes, it's a poop test, but it's a really important one. The immunochemical part means it uses antibodies, so think of them as tiny detectives to detect human blood. We then send this sample to the lab where the real magic happens. If there's any blood in your poo, the test will catch it. So blood in your stool can be a sign of various things, including colorectal polyps or even cancer. Catching it early can be a game changer for treatment. It's simple and it's not messy. It's just a tiny sample in a special kit. There are no dietary restrictions before, so you can eat whatever you want. If it's positive, it doesn't mean you have cancer. Only about 1 in 10 people who have a positive FIT will have some form of cancer. 4 in 10 people will have some polyps, which could be precancerous lesions. And then 5 in 10 people will have a negative colonoscopy. Colorectal cancer can sneak up on you without symptoms, so catching it early with a FIT test is a smart move. We have a national screening program for this in the UK over the age of 60. And remember, it's a bit like getting your car checked. Routine maintenance helps catch issues before they turn into big problems. So if your doctor suggests a FIT, please do not brush it off. It might just be a little poop test, it might be a bit weird or a bit gross, but it's a big deal for your health.